Hello, this is Dr. Wells with Wells Medicine, and I wanted to talk about what to look for in a ketamine clinic or a ketamine infusion provider today. I really think it's important that someone doing this work has been doing this for a while because ketamine does fall into a weird gray area between psychiatry, which has patients with mental health and mood disorders, and anesthesiology because ketamine is an anesthetic agent. But yet, ketamine also takes a significant learning curve to administer correctly and sensitively. And so there does need to be some expertise and experience, not only with the fields of anesthesia or psychiatry, but with the administration of ketamine. So I would always look for a provider who's been doing it for a while, is very comfortable, um, does this frequently. Frequency is another issue because when you're doing the initial 6 visits, the original studies had patients coming in 3 times a week. So if you have a ketamine provider who is only doing infusions once a week, or only when they're in that office, then you may be kind of stuck falling into a protocol that either doesn't work for you or can't really fulfill the original research protocols, which don't work for everybody, but they're definitely something to base a standard of care off of. If the provider isn't there, multiple times a week, then you may be kind of stuck in an emergency where you're changing your medicines or weaning off a medicine or having, a sort of a difficult time mental health wise. And you may need an infusion, but your provider isn't available for, another week because they're only operating 1 or 2 days a week. So it's very important not only to have that expertise, but to be available. Another thing I think is really important is that they understand, either from their own expertise or from having taken classes specifically around ketamine infusions, such as the IPI class or the CIIS class or an ASKP3 class. There are institutions now that provide education and training for people doing this work. So it is possible to find people that have extra education in the administration of ketamine for mental health. So for example, I've taken the IPI class, and I've been doing this for 10 years and done over 14,000 infusions. But those are things to look for in a provider. That gives them the expertise, or the instruction gives them a sensitivity to the setting, the need to have a quiet environment, the need to have calming sort of architectural features, and the need for privacy, and the need for a face mask or a blanket or calming music, or being able to dim lights. I'm hearing patients talking about being one chair out of multiple chairs in a recovery room, or in a space setup where you're facing another ketamine infusion patient, or you're in a tiny closet where there's lots of commotion of a busy office around. And that's just, a really unfortunate setting for ketamine infusions. I think the expertise also gives, a sensitivity to the disruption that a ketamine infusion can cause in a patient's psyche. So, whether they have a good trip or a bad trip, ketamine can cause patients to realize they need to make changes in life, and those changes all change, but some changes can be very significant, very disruptive, very unsettling. Sometimes patients can have, memories come up for them, not frequently, but sometimes, that can be a lot for them to handle. And to be able to kind of hold that psychological space is a skill set. It can be learned, but it's a skill set that a provider needs to have. So if they're rushing around and multiple people all in one room and there's no privacy, and patients really aren't able to have that psychological experience or to be able to sit comfortably with that intense emotional psychological experience. That can be a lot. For a patient to handle by themselves or to, if they're rushed out of the clinic, um, because they need that chair or because the provider's leaving, that can be something that, patients need that time to wake up, that time to not only get their feet under them and be sturdy, uh, but also to be able to psychologically get their feet under them and be sturdy. I hear rumors of people having these very busy ketamine clinics where they're rushing patients through or not allowing them to kind of digest the information they're receiving, and that's worrisome to me as well. So another good flag, I think, to look for is a holistic approach. So at Wells Medicine, we view ketamine as a tool, but part of a tool in a toolbox where you're also looking at lab results and you're looking at, therapies, and you're looking at, are there any medicines that could make patients have worsening depression, or you're looking at lifestyle factors. Ketamine as just a blunt instrument of change is just that. It's very blunt. And it may not be as effective as patients would want. Certainly, there are reports of people doing ketamine on the street recreationally, and they're not the happiest people on the block. I think ketamine as a tool and used as a tool can be incredibly effective, but ketamine in a vacuum, while effective in the studies, just is not as effective as ketamine being used, with kind of surgical precision. I think another thing to look for is I don't think ketamine as an adjunct to an IV drip spa makes a lot of sense when patients are receiving also IV fluids, because ketamine can make you need to pee, and then you're getting a giant liter of saline. Patients can get very uncomfortable quickly because in the middle of the infusion, while they're receiving all the saline, suddenly they have to go to the bathroom. Some clinics are also doing an infusion of NAD, NAD, at the same time. NAD infusions can cause some dysphoria. So to add that on top of ketamine, I think is an unskillful use. It's wonderful that patients already have an IV, and that's great and a very efficient kind of thought process, but that tells me they don't know that NAD can cause some dysphoria, and then to add that on top of ketamine isn't a great use of the ketamine infusion. I have a patient right now who's occasionally going to a place where they receive iron infusions and ketamine at the same time. I don't think that's a really great duplicate use of the time. Seems very efficient, but iron infusions can cause itching and allergic reactions and, dysphoria themselves and some, discomfort in the body that is not great to combine with the ketamine. So I think, there are some things that can tell you whether a place has approached this maybe not with efficiency in mind, but maybe with thoughtfulness and with the best results from the ketamine infusion in mind. And again, I don't disagree with NAD infusions or a liter of fluid or iron infusions, but I don't think they combine well with ketamine. And I have some other videos discussing NAD and iron and IV infusions for saline. So feel free to check those out as well. I'm a big believer, that vitamins and, proper hydration can substitute for a lot of that. But I think those are things to look for when evaluating whether a ketamine clinic might be the right place for you, whether, the right provider to provide a pretty sensitive service. Feel free as well to look around on people's websites, interview them, interview their staff. You're going to be having a lot of interactions with the staff at any clinic that you go to, and kind of get a sense of who the provider is as well. You want someone, with good bedside manner, but also they need to know what they're doing with the medication, and with the psychological space that they're holding. So, in brief, uh, the things to look for in a ketamine provider are experience, expertise, sensitivity to the power and potency of the medication, and a bedside manner that you find comforting and relaxing, and that you feel comfortable having an experience like this with that person, with that clinic. Those are the things that I think are very important for a ketamine provider. I'm going to have another video later to touch on safety elements that are a little bit less easy to look for. Certainly, I don't think most providers will show you their ACLS cart, but and those won't be things that are as obvious on a website. But those are the things that are easier to look for in a ketamine provider when talking to their staff, looking through their website, and looking for their credentials.